Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The occupational self-assessment evaluates an individual's perception of their occupational competence and the value they assign to various daily activities. It focuses on areas such as self-care, productivity, and leisure, which are critical to occupational performance. The tool assists in identifying strengths and limitations related to physical, cognitive, and psychosocial functions. Its main purpose is to guide healthcare professionals in developing client-centered intervention plans that enhance participation and promote functional independence in individuals with conditions such as stroke, traumatic brain injury, or chronic pain. The assessment facilitates collaborative goal setting by capturing the client's perspective on their occupational engagement. The occupational self-assessment is indicated for adults experiencing occupational performance difficulties due to physical, cognitive, or psychosocial impairments. It is particularly useful for patients with chronic conditions, mental health disorders, and rehabilitation needs following injury or illness. The tool is most effective in clinical contexts focused on client-centered practice and functional outcomes, such as occupational therapy evaluations, community-based rehabilitation, and mental health services. Evidence supports its use in identifying perceived competence and value placed on daily activities, aiding in goal setting and intervention planning. The occupational self-assessment consists of 29 items designed to evaluate an individual's perception of their occupational competence and the impact of the environment on performance. It includes 2 sections: competence and value. Each item uses a 4-point Likert scale for responses, ranging from "I have no problem doing this" to "I have a lot of difficulty doing this" in the competence section, and from "not important to me" to "very important to me" in the value section. To perform the assessment, the clinician instructs the client to first rate their level of competence for each activity, followed by a rating of the importance of each activity. After completion, raw scores for competence and value are calculated independently. These raw scores are then converted into interval-level scores using a rash analysis conversion table provided with the tool. Interpretation involves comparing the competence and value scores to normative reference ranges established from adult populations. Scores below the 50th percentile indicate possible occupational performance issues, while scores above the 75th percentile suggest higher self-perceived occupational competence and value. Discrepancies between competence and value scores may highlight areas where a client values an activity but experiences difficulty, guiding targeted intervention planning. Sensitivity refers to the ability of the occupational self-assessment to correctly identify individuals who have a particular occupational performance issue. Specificity refers to the tool's ability to correctly identify individuals who do not have the issue. According to empirical studies, the occupational self-assessment demonstrates a sensitivity ranging from 0.70 to 0.85, indicating it correctly detects 70 to 85% of true positive cases. Its specificity ranges from 0.65 to 0.80, meaning it correctly excludes 65 to 80% of true negative cases. For example, in a clinical setting where a therapist uses the occupational self-assessment to determine clients with limitations in daily activities, a sensitivity of 0.80 ensures that 80% of those with actual difficulties are identified. Meanwhile, a specificity of 0.75 implies that 75% of those without difficulties are accurately recognized, reducing false positive results and ensuring appropriate intervention. The The occupational self-assessment was developed in the late 1990s by Mary Law and colleagues as a client-centered instrument designed to measure an individual's perceived competence in daily activities and the value they place on these activities. Validation studies have demonstrated that the assessment exhibits sound internal consistency, with Cronbach's alpha coefficients reported above 0.9 for both the competence and value scales. Test-retest reliability has been confirmed through intra-class correlation coefficients ranging from 0.75 to 0.85 over intervals of 1 to 2 weeks. Convergent validity has been established through moderate to strong correlations with other standardized functional measures, such as the Canadian Occupational Performance Measure and the assessment of motor and process skills. Factor analyses conducted on diverse populations support the two-factor structure of the instrument, corresponding to self-perceived competence and the importance assigned to occupational tasks. Furthermore, its sensitivity to change has been evidenced in intervention studies, indicating the tool's responsiveness in capturing meaningful progress during rehabilitation. The occupational self-assessment has been validated across various clinical groups, including individuals with stroke, psychiatric disorders, and chronic musculoskeletal conditions, corroborating its applicability in heterogeneous healthcare settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.